In this video, I'm about to show you how a massive hospice network in California got busted after listing perfectly healthy patients as dying. These weren't mistakes. This wasn't a paperwork error. This was a sophisticated fraud ring that enrolled over 3,000 patients into hospice. Patients who weren't terminal, patients who weren't even sick, patients who had no idea they had been listed as dying, and they got away with it for years, until the feds came knocking. Let's get into it. The Department of Justice announced in early 2024 that a network of 6 hospices operating across Southern California had been shut down. The network, operating under the umbrella name Golden State Hospice Group, had locations in Los Angeles, Orange County, Riverside, San Bernardino, San Diego, and Bakersfield. According to the unsealed indictment, Golden State Hospice Group submitted over $63 million in fraudulent claims to Medicare between 2019 and 2023. They enrolled over 3,000 patients who did not meet hospice eligibility requirements. Some of these patients had minor conditions like high blood pressure, some had arthritis, some had no documented medical conditions at all. The DOJ has charged 14 people so far. The mastermind was Dr. Robert Kleinman, a 68-year-old physician from Beverly Hills. The chief operating officer was Linda Foster, a registered nurse. The marketing director was David Chang. The compliance officer, yes, they had a compliance officer, was Michelle Harper. And there were 10 other co-conspirators, including billers, recruiters, and pharmacists. But here's what makes this case different from the others we've covered. This network didn't just enroll fake patients, they also enrolled real hospice patients and then provided almost no care. They collected the same daily rate, over $200 per patient per day, while sending nurses to see patients maybe once a month instead of daily, sometimes not at all. One patient, Margaret O'Brien, an 86-year-old woman with actual terminal cancer, was enrolled in a Golden State Hospice for 11 months. In that time, she received exactly 12 nursing visits. 12 over 11 months. That's about 1 visit per month. Medicare requires daily visits for patients in crisis and at minimum weekly visits for routine care. Golden State provided neither. They just billed and billed and billed. Margaret's daughter, Susan O'Brien, told investigators that she had to hire a private nurse because the hospice wasn't showing up. She paid out of pocket $60,000 over 11 months, while Golden State billed Medicare for over $40,000 for care that was never provided. That's the real evil of this scheme. It's not just stealing from taxpayers, it's stealing from dying people and their families, people who are already going through the worst time of their lives and making it worse. Let me walk you through exactly how this fraud ring operated because it's more sophisticated than most. Golden State Hospice Group had 6 locations. Each location had its own Medicare provider number. That allowed them to spread their claims across multiple numbers, making it harder for Medicare auditors to spot the pattern. Here's what they did. First, they used a network of patient recruiters, David Chang and his team, to find elderly patients. They targeted senior centers, low-income housing complexes, and adult daycare facilities. They offered seniors free benefits and extra services. They never mentioned that enrolling in hospice means waiving standard Medicare benefits. One recruiter, Maria Sanchez, was recorded telling a senior, "It's just a paperwork thing. You don't actually have to be dying. We just need your signature." That recording is now evidence in the federal case. Second, once patients were recruited, Dr. Kleinman falsified their medical records. He created fake terminal diagnoses, lung cancer, pancreatic cancer, end-stage renal disease for patients who had none of these conditions. He backdated certifications. He forged the signatures of other physicians who had never met the patients. The indictment includes evidence that Dr. Kleinman signed over 4,000 hospice certifications between 2019 and 2023. That's nearly 3 per day, every day, including weekends. At his deposition, he claimed he reviewed each patient's chart thoroughly, but investigators found that over 800 of his certifications were for patients he had never seen. The charts didn't even exist when he signed them. Third, Linda Foster, the chief operating officer, assigned each patient a nurse on paper. But the nurses, the few they actually employed, were instructed to see patients as rarely as possible. One nurse, Jennifer Walsh, testified to the grand jury that she was told to check the box for daily visits even when she only went once a week. She said she was required to fill out identical nursing notes for every patient, regardless of their actual condition. When she complained to Foster, she was told, "That's how it works at every hospice, don't make waves." She quit 3 months later. And then she became the whistleblower who triggered the entire investigation. Dr. Robert Kleinman was a respected physician. He had been practicing medicine for over 40 years. He was board certified in internal medicine and geriatrics. He had admitting privileges at 3 hospitals in the Los Angeles area. He had published papers in medical journals, and he used all of that credibility to defraud Medicare of over $60 million. According to the indictment, Kleinman was paid a salary of $800,000 per year by Golden State Hospice Group. That's nearly 4 times what a typical medical director at a hospice makes. He also received bonuses based on patient census, $2,500 for every patient over a certain threshold. The indictment includes an email that Kleinman sent to Foster in 2021. He wrote, "We need to increase our census by 20% by end of quarter. I don't care how you do it, just do it. My bonus depends on it." Foster replied, "We've already exhausted the senior centers. The only way to get more patients is to take them from other hospices." Kleinman wrote back, "Then get them. Offer kickbacks. I don't care. Make it happen." That email is now Exhibit A in the government's case. Kleinman used the money to fund an extravagant lifestyle. He bought a $5 million home in Beverly Hills. He drove a Bentley. He owned a vacation home in Cabo San Lucas. He spent over $300,000 on a single trip to Europe, first-class flights, 5-star hotels, private guides. When the FBI raided his home in November 2023, they found over $1 million in cash in a safe in his closet. They found jewelry valued at over $2 million. They found documentation of wire transfers to offshore accounts in the Cayman Islands, Switzerland, and the Bahamas. Kleinman was arrested at his home. He tried to flee out the back door. FBI agents caught him in the backyard. He's currently being held without bail. The judge called him a serious flight risk and a danger to the community. His medical license has been suspended. He's facing up to 80 years in federal prison. Linda Foster was the chief operating officer. She had been a registered nurse for over 30 years. She had worked in legitimate hospices before joining Golden State. She knew the rules. She knew what qualified as a terminal diagnosis, and she oversaw the entire fraudulent operation. Foster was responsible for staffing, patient care, and compliance. Yes, Golden State had a compliance officer, Michelle Harper, but Foster overruled her at every turn. According to the indictment, Foster instructed nurses to falsify patient records. She instructed billers to submit claims for services never provided. She instructed recruiters to target vulnerable seniors. One email sent by Foster to the entire staff in 2022 reads, "We are a hospice. Our job is to provide comfort care. Comfort care is subjective. There's no objective measure of whether a patient is comfortable, so bill for everything. The auditors can't prove otherwise." That email is now evidence of fraud. Foster's salary was $300,000 per year. She also received bonuses based on patient census. In 2022 alone, she received over $150,000 in bonuses. She used the money to buy a vacation home in Lake Tahoe. She also bought a boat and a luxury SUV. The DOJ has seized the vacation home and the boat. Foster was arrested at her home in Orange County. She's charged with healthcare fraud, conspiracy, and money laundering. She could face up to 50 years. Her nursing license has been suspended. She's out on bail, $1 million, and is confined to her home with GPS monitoring. Jennifer Walsh was a nurse who worked for Golden State Hospice Group for just 3 months. In that time, she witnessed so much fraud that she couldn't stay quiet. Walsh testified to the grand jury that she was assigned over 50 patients. She was told to see each patient once a week, but to document daily visits. She was given pre-filled nursing notes, all identical, and told to sign them regardless of whether she had seen the patient. When she asked her supervisor, Linda Foster, why she was being asked to falsify records, Foster told her, "That's how we do things here. If you don't like it, there's the door." Walsh quit the next day, and then she called the HHS Office of Inspector General. She provided copies of patient files, billing records, and emails. She identified specific patients who were not terminally ill. She provided the names of recruiters who were targeting seniors at adult daycare centers. The OIG opened an investigation. Within 6 months, they had referred the case to the FBI. Walsh is eligible for a whistleblower reward of up to 30% of what the government recovers. In the Golden State case, that could be up to $19 million. Not bad for doing the right thing. But Walsh told reporters that she didn't do it for the money. She did it because, in her words, "I couldn't sleep at night knowing that dying people were being neglected while the executives got rich." That's the kind of person we need more of. Let me tell you about some of the victims, because this is the part that makes me angriest. Harold Jenkins, a 79-year-old veteran from Riverside, was enrolled in a Golden State Hospice for 2 years. He had no terminal diagnosis. He had high blood pressure and diabetes, but nothing terminal. He was still working part-time at a hardware store. He had no idea he was in hospice until a federal agent knocked on his door. Doris Washington, an 82-year-old widow from San Diego, was enrolled for 3 years. She had mild dementia, but mild dementia is not a terminal diagnosis. She could still live for 10 or 20 years, but Golden State listed her as having terminal Alzheimer's disease. She didn't have Alzheimer's, she had age-related memory loss. Elena Ramirez, a 74-year-old woman from Bakersfield, was enrolled for 4 years. 4 years. Hospice is for 6 months. She had no terminal diagnosis. She had arthritis and high cholesterol. That's it. Golden State billed Medicare for her for 48 months, over $300,000. James Thompson, a 68-year-old man from Los Angeles, was enrolled for 18 months. He had no terminal diagnosis. He had high blood pressure. He was still working as a truck driver. Golden State listed him as having terminal lung cancer. He had never had a chest X-ray. These are not isolated cases. The DOJ has identified over 1,500 patients who were falsely enrolled in Golden State hospices. 1,500 people who were told or not told that they were dying. 1,500 families who may have spent years thinking their loved one was terminal. Some of these patients died during the investigation. They died not from their fake terminal illnesses, but from old age, from accidents, from other causes. But they died believing they had cancer or heart failure or Alzheimer's, because Dr. Kleinman needed a bonus. That's not fraud, that's cruelty. And here's something else that didn't make it into most news reports. Some of these patients were so convinced they were dying that they changed their wills. They gave away possessions, they said goodbye to grandkids who lived out of state, they made funeral arrangements. One patient, Robert Morrison, a 76-year-old man from San Bernardino, sold his house and moved into a small apartment because he thought he only had a few months to live. He was listed as having terminal pancreatic cancer. He didn't have pancreatic cancer, he had acid reflux. When investigators told him the truth, he broke down. He had sold the home he lived in for 30 years. He had uprooted his entire life because a doctor he had never met signed a piece of paper saying he was dying. That home was worth $400,000. He sold it for $300,000 in a panic. He lost $100,000. Dr. Kleinman got a bonus. That's not a billing error. That's not a paperwork mistake. That is deliberate, calculated cruelty. And it happened to hundreds of people. Hundreds of families torn apart because a corrupt doctor needed to hit his quarterly numbers. The DOJ is asking for restitution. But you can't give a man back the home he sold because he thought he was dying. You can't give him back the years of peace he lost. You can't give him back his sense of security. That's gone forever. And Kleinman? He was flying first class to Europe. Golden State isn't the only hospice fraud case the feds have busted. Let me tell you about 3 others. Case 1, Texas. Novus Health Services in Houston paid over $13 million to settle hospice fraud allegations. They were billing for patients who weren't homebound. One patient was actually attending college full-time while listed as receiving hospice care. The owner, Marcus Webb, used the money to buy a Ferrari, a yacht, and a vacation home in Florida. He's currently serving 12 years in federal prison. Case 2, Georgia. Asana Hospice in Atlanta was shut down by the FBI. They had enrolled over 300 patients who didn't qualify. The owner, Dr. Michael Chen, signed certifications for patients he had never met. He admitted to federal investigators that he sometimes signed stacks of blank forms. He's serving 36 months. Case 3, Illinois. American Hospice Management in Chicago paid $15 million to settle claims that they had billed for services never provided. Their marketing director had been paying kickbacks to nursing homes to refer patients, $500 per patient. The marketing director, Patricia Gomez, is serving 18 months. These cases have something in common: corrupt medical professionals who put profit over patients, doctors who took an oath and broke it, nurses who knew and did nothing. executives who got rich while real patients suffered. The investigation into Golden State Hospice Group started with that whistleblower, Jennifer Walsh. In early 2022, the HHS OIG opened a file. Within 3 months, they had referred the case to the FBI. The FBI spent the next 18 months building the case. They interviewed over 200 witnesses. They subpoenaed bank records, phone records, and email servers. They executed search warrants at all 6 Golden State locations simultaneously: Los Angeles, Orange County, Riverside, San Bernardino, San Diego, and Bakersfield. At the Los Angeles location, they found boxes of patient files, over 3,000 of them, most of which contained forged signatures and fake diagnoses. They also found evidence that the network was trying to cover its tracks. In 2023, after learning that the OIG was asking questions, Linda Foster ordered her staff to shred patient files and delete emails. The FBI recovered shredded documents from a dumpster behind the Los Angeles office. They also recovered deleted emails from the company's backup servers. That evidence is now part of the criminal case. Foster faces an additional charge of obstruction of justice. Let me tell you something else about this investigation. The FBI agents who worked this case spent over 2 years tracking down patients and interviewing families. They visited over 1,000 patients in person. 1,000. Many of them were elderly, confused, and had no idea why federal agents were knocking on their door. One agent told a reporter that she had to explain to a 92-year-old woman that she wasn't dying of cancer, that she had been listed as terminal for 4 years by a doctor who had never even examined her. The woman cried. She had spent 4 years thinking she was dying. 4 years of anxiety, of saying goodbye to family, of living in fear, all because Dr. Kleinman wanted a bigger bonus. That's the human cost of fraud. It's not just money, it's years of a person's life stolen. Years they could have spent enjoying retirement, traveling, being with family. Instead, they spent them terrified that any day could be their last. And Kleinman? He was trying to flee to Switzerland. That tells you everything you need to know about who these people are. After watching this, you might be wondering, could this happen to someone I love? The answer is yes. Hospice fraud targets the elderly. Here's what you need to know. Hospice is for people with a terminal diagnosis, 6 months or less. If a hospice contacts you out of the blue, be suspicious. Legitimate hospices get referrals from doctors, not cold calls. Ask questions. What is my diagnosis? Which doctor certified me? Why do I qualify for hospice? If you don't have a terminal illness, you don't belong in hospice. Check your Medicare summary. Notice, look for hospice claims. If you see hospice charges for someone who isn't in hospice, report it immediately. The number to call is the HHS OIG hotline, 1-800-HHS-TIPS. That's 1-800-447-8477. You can report anonymously, and if you report fraud that leads to recovery, you might be eligible for a whistleblower reward, up to 30% of what the government recovers. In the Golden State case, Jennifer Walsh is eligible for up to $19 million. If you have a loved one in hospice, visit them. Ask to see their care plan. Ask to meet their nurse. If something seems wrong, speak up. This case isn't just about $63 million. It's about what that money represents. Every dollar stolen from Medicare is a dollar that isn't available for legitimate patient care. The National Hospice and Palliative Care Organization estimates that over 1.5 million Americans receive hospice care each year. That's 1.5 million people with terminal illnesses, people who are dying, who need comfort care, who deserve to spend their final days in peace. When fraudsters like Dr. Kleinman and Linda Foster steal from Medicare, they're not stealing from the government. They're stealing from those 1.5 million people. They're stealing from the grandmother with cancer, the grandfather with heart failure, the child with a terminal genetic disorder. The DOJ is cracking down. In 2023 alone, they announced charges against over 70 medical professionals in 20 different fraud schemes. Total fraudulent billing, over $2 billion. But for every case that gets caught, how many are still operating? The DOJ estimates that healthcare fraud costs taxpayers between $60 and $100 billion per year. Billion with a B. That's your money. That's my money. And it's being stolen by people who think they won't get caught. Dr. Kleinman thought he wouldn't get caught. He was wrong. He's sitting in a cell right now waiting for his trial. Foster thought she could shred her way out of trouble. She was wrong. She's under house arrest, facing 50 years. The feds are watching, the whistleblowers are coming forward, and the fraudsters are going to prison. But they can't do it alone. They need you to pay attention, read your Medicare statements, ask questions, report suspicious activity. We have to protect the Medicare system. Not because it's perfect, it's not, but because millions of Americans rely on it. Every dollar stolen is a dollar taken from a grandmother who needs chemotherapy, a grandfather who needs surgery, a family who can't afford private insurance. The people running Golden State Hospice Group didn't think about any of that. They thought about themselves. They thought about their bonuses, their boats, their vacation homes, and now they're facing federal prison.